like 10 to 20 years.
I got
of
it.
Things that I see doctors in hospitals becoming obsolete, especially if they're getting $5 a patient, which doesn't make any sense. But anyway, I'm saying there will be preventive wellness centers, meaning nutrition, diabetes, awareness, health, everything you need, because the hypocritical of this, the body heals itself.
Sure.
So all you have to do is keep it maintained and aware of what it needs to do, and what to do.
Sure.
Protect itself from doctors and hospitals. So I see we're into preventive wellness, which it took 10 to 20 years to get into that.
Sure.
But from there, they're going to, doctors and hospitals will become wellness centers, preventive wellness centers.
Well, you know, that is the idea that, you know, modern medicine should be kind of moving toward the preventative and, you know,
Yeah, because
preventative
it's-
side rather than just treating the ailment when it comes.
Which is too late.
I would assume that's not probably the best for maybe pharmaceutical companies and,
Oh, that's,
you know,
that's, they
insurance
only need to go
companies.
out the way they rob people,
but.
kill themselves with their drugs. They're killing them every day.
But also, one of the big things about prevention is education. So that's why we do these things.
Education
Today,
would be part of the wellness center,
Sure.
education,
of
awareness,
course,
you
of
know,
course.
charts and diagrams and everything, massage therapy, physical therapy, exercise,
Sure, sure.
and that's what they will become because there's people tired of being cut out. And the doctors still don't have answers. They tell you how much they don't know. They send you doctor, drug, and they still don't know.
Sure.
Right. Amen.
So I'm going to do a presentation on diabetes, and I know that some of you probably know a lot about diabetes, but I think re-education is always a good thing. Okay, well then that's perfect. Perfect. And you know, with this room as well, this is a support group, so I'm sure after I'm done, I won't take up too much of your time. You can also get some insight into somebody who has been living with diabetes for a long time.
25 years.
Right here?
Right there. 98.
Look at you.
She's 97.
97.
Congratulations. You know, they're saying 142, so keep going. I'm serious, and then they're going to 200. People already in that bracket, they're already there.
Anyway.
All right.
So just stay healthy, just
Any questions
Sure.
before we start?
No.
There was one more thing I wanted to ask.
Sure.
And now I forget what it was. What do you do with the parts when you forget what the question is?
Say that again?
What do you do with your brain when you forget what the question
You
is?
hope it comes back to you, and if it doesn't,
Then you check
then,
out and
then
see.
it will, yeah. Eventually, it may come back, it may not. I'm a big advocate for writing things down because I forget everything. But then sometimes I lose what I wrote it down on. And I find it 6 months later on like a little post-it that's like buried in a
Right.
book or something. You know, it happens. So I try to not write all the most important things on the same piece of paper because I lose that on piece of paper.
That would help.
You know, it's not great. All right, so we're gonna get started, okay?
Yes.
All right, so today we're talking about diabetes. My name is Jordan. I am an RN to BSN student at Frostburg.
That's what I was going to tell you. My ex-husband has had it for years and years and years. I'm 81.
Uh-huh.
So he's had it for years and years. And he eats and sugar. I'm surprised he has his arms and his legs. You know, because nothing's gone down on him. He eats all these things you do not eat as a diabetic.
Yeah. Well, you know, everybody's body responds differently. You know, a good thing to do though is being able to know the symptoms and know what to expect so that you can watch out for these specific things. You know, somebody who's had diabetes for a long time that's somewhat unmanaged, even if it is managed, you know, the things that you want to kind of do annually or daily is, you know, you want to see the eye doctor. You want to get your feet checked, see a podiatrist, stuff like that, because you know you're also looking for diabetic neuropathy, stuff like that. But I promise there'll be plenty of time for questions, and you know I'm also very nervous, so I'm gonna keep rolling. All right.
But keep rolling because when my daughter comes, I have to leave. So I'd like
All right.
Yeah,
Oh,
so.
my
So-
daughter's right here with me, so we know.
Yeah, but mine's
We
coming
can
to
only
get
stay
me.
till like 1:15, so
Mine's-
whatever.
mine's-
We
Okay.
have to be here, but we didn't
I'll-
plan this, so
No
we're
worries.
crashing
always.
your party.
So, diabetes who? What is diabetes? So, diabetes is a disease that occurs in your pancreas There's 2 types of diabetes that I'm going to talk about. There are other types, but the most common ones are type 1 and type 2. So type 1 normally happens at an earlier age in life. You can be diagnosed as a child or an adolescent, but that is when your pancreas does not make any insulin for your body. Now type 2 can also mean the same thing. It can happen later in life, but can be, contributed to other things, or, it can approach at a later time in life in a different way. Now, as a type 2 diabetic, you can also not produce insulin, or you just produce insulin poorly. All right? Now, type 2 is the most common in America, and I think the numbers are like 65 million ages 65 and older have been diagnosed with diabetes, and that number rises every year. All right. So first we're going to talk about hyperglycemia, as you were asking. So the information that I pulled from was National Institute of Diabetes, NIH, and Mayo Clinic. So they talk about hyperglycemia as being your blood sugars sustained over 200. And that can happen in type 1 and type 2. Causes of this can be food, physical activity, illness or infection. And what I mean by illness or infection is infection can have a abnormal effect on your blood sugar levels. Infection can tend to raise your blood sugar pretty high. And that's a lot of the times what I see personally as a nurse that works in an inpatient setting. A lot of times people with diabetes that come in, a lot of times they're coming in for, many different things or just other things in general. Let's say, as an example, a UTI. Ages 65 and older is pretty common to have a UTI. That infection can contribute to elevated blood sugars. Okay? Or as an example, somebody with respiratory issues who was on, let's say, a steroid. Steroid has been known to increase your blood sugars. And somebody who is normally pretty normal with their blood sugars, they take it every day, and they take their insulin, or they don't take their insulin, or they're on a oral medication for diabetes, or they just sustain pretty well with diet and exercise, with adding a steroid to the mix for something respiratory or inflammatory can also raise your blood sugar levels as well. And this is what I mean by medication non-diabetes, and also skipping your diabetes medication. Being non-compliant for somebody who is insulin dependent can result in your blood sugars levels being elevated. So some of the signs and symptoms of hyperglycemia: frequent urination, increased thirst. So you're thirsty, but you're continuing to urinate. You're more thirsty, and you're just peeing it out really rapidly. Blurred vision, fatigue, headache, dry skin, confusion, weakness, and nausea and vomiting. So kind of just like very tired, fatigued, flu-like symptoms-ish, nausea and vomiting. So, you're losing a lot of water, and you're still remaining thirsty. Your blood sugar levels continue to rise. And here's just a little picture of, some other symptoms that you might see, but kind of the same ones that I had talked about. Drowsiness, nausea, hunger, frequent urination. So knowing your signs and symptoms are a great way to start, because they may manifest different ways for different people. I've spoken to some diabetics who say, I get really confused, or I have a hard time recalling memories or recalling words. And then some say, I just start peeing all the time, and I know that's when my blood sugars are really high. It manifests in different ways. It doesn't mean you're going to have every symptom, but you can have one or two, or you're going to have ones that are specific to you. And people who have had diabetes for a long time are very good at recognizing the symptoms as well. All right, so this is a slide about knowing when to call your doctor or knowing when to call 911. And we were speaking earlier, I was speaking with somebody earlier, and they were saying that she feels as though, and from what she's talked to people in the diabetic community, that they tend to wait a lot longer to call their doctor or call 911 or call somebody to take them to the emergency room, because they feel as though they're a bother, and it's just their blood sugar.
Right.
So the thing with diabetes is elevated blood sugars can turn into a very serious, dangerous situation. So
It
They're
can
called-
kill you,
I'm sorry.
it can kill you,
Progressively, yes. Yeah.
progressively, but not right away.
Well, you could go into a state of like something called a diabetic coma, and that has a large effect on your body, and that's when other organ systems become involved as well. When you go into something called like DKA or HHS, which is sustained blood sugars at a very high number.
But does that always happen at the lower level as well?
We're going to talk about hypoglycemia
Hypo
too.
versus
Yeah.
hyper. Got it.
Because there's some people who always are hypo.
Yeah.
So with hyperglycemia, somebody, my personal experience is somebody who's having extremely elevated blood sugars. I've seen them as high as 900 and
Oh
1100,
goodness.
and it's a very dangerous time. And they require, a lot of observation and a lot of intervention because it's very dangerous.
See, I thought I was hypoglycemic, but not because of any of your symptoms that you talked about, but the fact that if I don't eat every few hours, I get woozy. So I thought it was hypoglycemic, like I eat all day long, every 2 or 3 hours. I eat.
Sure. Well, we'll talk about some other ways that you can talk to your doctor, some early signs
But
as
is
well.
that an early sign, that the fact that you,
Just hungry all the time?
no, I'm trying to do portion control, but if I don't eat, then I get funny. My body
Fidgety?
says, my body
Little
says
lightheaded?
eat. It says eat.
Well, your body does need nutrients, and sometimes, a sudden change in your calorie intake takes a little adjustment. I think
No, I'm
that's
talking about every day, I'm not talking about sudden changes.
okay. We're gonna get back to that, I promise. Okay. All right. So, calling your doctor when you're experiencing ongoing diarrhea and vomiting, but you're still able to keep down water and food. Okay. Fever lasting more than 24 hours, because that can indicate an infection as well. Blood sugar is above 240 after you've taken your insulin or PO medication. But you're still able to stay hydrated, still able to take food in. You want to let your doctor know, and they can tell you where you go from there. Now, calling 911, I would say with National Institute of Health and Diabetes at NIH, they would say if you have sickness or an illness that is prolonged, that is making you unable to keep down water, unable to keep down food as well, because with the increased urination, you're also going to become dehydrated. And that can also contribute to elevated blood sugar as well, the more dehydrated you get. Persistent fevers and blood sugar over 240 and rising, and then ketones in your urine. Okay? And then also, when your blood sugars are highly elevated, you can also taste like a fruity pebble type of odor from your mouth. It's very specific to hyperglycemia, but it's a very fruity smell coming off of the odor from your mouth, your breath. All right, so now we're going to talk about hypoglycemia. So hypoglycemia is low blood sugars that fall below 70. Okay, and this is when you need to act as well. Now, I know that everybody probably takes their their blood sugar readings at different times of the day or how often they do, but most of the time, if you're pretty healthy, you do know what your numbers are going to gradually be over a period of time, but that doesn't mean somebody can't become hypoglycemic as well. So if your glucose levels drop below 70, your brain is not receiving enough glucose and your function can be impaired. So that's also recognizing the signs and symptoms of hypoglycemia. And this can also happen for a lot of people who take insulin for the type 1 or type 2 diabetes. Because insulin is a lot more fast acting, depending on the type of insulin, than, let's say PO or by mouth diabetes medication like metformin or glipizide. Okay? All right, so why is this important? So hypoglycemia is one of the common causes of hospitalizations according to Medicaid and Medicare. So they see a larger number of admissions to the hospital due to hypoglycemia than they do hyperglycemia. And this is one of the statistics I gave earlier. Today, 11.2 million people 65 and older have diabetes. All right? But is perfectly livable. All right, so causes of the hypoglycemia. As I was saying earlier, too much insulin, or the timing of the insulin, and when you're eating can contribute. Sometimes the times are off. That can be a factor. And then changes in your insulin doses. Let's say you are moving to a different medication, or you're adjusting the times of your insulin, or the times that you're taking your blood sugar. It may not correlate perfectly to how you used to do things, but you're still following a normal schedule. The misconception in time can be a factor as well. Food intake, not eating enough carbs. Now, just because you're diabetic doesn't mean you don't need carbs, because everyone needs carbs to sustain, right? But not eating enough can also be a factor. All right, and so increased physical activity among type 1 diabetics can result in hypoglycemia. Now, there are times that activity can result in hyperglycemia. It's just how your body responds. And a drop in glucose at nighttime, which happens with a lot of people, can be a factor as well. And that can be due to medications and when they're actually peak times, and when they're most effective can also be a factor as well.
Why do you specify just type 1 diabetics for the physical activity bringing it
That I'm not sure. I never really learned the correlation between why somebody with type 2 diabetes or type 1 diabetes, why the blood sugars rise for some people and some of them drop. I'm not exactly sure. What I do, my theory, which is not proven by anything that I've researched currently, just from my own experience of having family members that are diabetic or type 1 diabetic, I feel like it has something to do with the fact that a lot of them are on long-acting insulins, and as they're burning calories during physical activity, their insulin is also contributing. Exactly. So it's kind of like a double-edged sword type of thing. That's my theory, although I have not researched that fully, just because I have noticed there's research behind it rising and dropping.
And everybody's body is different.
Yeah.
Exactly.
So just that one fact alone can make it go up or down, depending on how your body takes it.
So, does anybody know what the signs and symptoms of hypoglycemia look like?
Hypo,
It means
Yes.
low blood sugar.
severe
Shakiness.
sweating.
Perfect. Shakiness, severe sweating. Anything else? Confusion, which can happen in hyperglycemia as
Or
well.
they're not,
Dizziness,
well, and they don't even seem to be coherent. They're not
Lethargic.
aware-
tired.
Yeah, but kind of out of it. I mean,
Yeah.
Not themselves, right?
Sir,
Yes.
that's my daughter.
Yes.
That's my youngest daughter.
The youngest.
And I don't know whether she's going to the medical field this smart or not. She's very good at what she does.
She's very knowledgeable.
I'm visiting here
Are you?
in Tennessee.
Welcome.
I came in December. We went to New York to visit my other daughter. I've been here ever since. Looks like I might be stuck in Maryland.
It's not so
But
bad.
it looks like you're stuck with someone who's good to be around.
thank you, my friend.
Now, lucky you. In a moment, maybe the girl can tell what happened to me when was it last
It
week?
was just last Thursday, that's why I knew the symptoms so well.
Sure.
Hers dropped to 28, but
can I
we'll
hear the
save all
story?
that because we gotta leave, Mom.
Okay.
We'll come back another day, but good luck to you,
Perfect.
friend. Yeah.
Why
Hers-
don't they, since it's serious, why don't they come in here and start checking people and getting more involved with this? since
So when
it's
it comes
happening?
to checking blood sugars,
Just started.
because there's an actual penetration of the skin, I think there's more insurance factors involved.
Yeah.
They can do education, but that would be, I would say that's more for a diabetes certified educator to really do that. And what you said earlier, confusion or just not there.
But she was just
60,
sweating and she was
65 and older, they say there's a large neurological response for
Absolutely.
hypoglycemia.
And I did.
Thank you very much, guys.
Okay, I'm sorry.
And here's just a little figure, just shows some of the Signs and symptoms of hypoglycemia: headache, ringing in the ears, trembling, irritability, weakness or tiredness, feeling anxious, hunger, increased heart rate, blurry vision, and sweatiness. All right. So, I want to talk about the 15 and 15 rule. Okay? If your blood sugar is below 70, you must act. You must do something. Have a good night, guys. First, you want to eat a snack that contains about 15 grams of carbohydrates. Then 15 minutes later, you want to retake your blood sugars. And if it has not risen above 70, you want to have another snack that contains about 15 grams of carbohydrates, and then recheck. All right?
So why don't they just check blood sugars? I mean, why don't you just check and see if you're in the range or something's happening and you don't even know?
Well,
The only
A
thing
lot of-
that I have in any of that is you know, if I don't eat for so many hours, then I get family, I have to eat.
but a person who is diagnosed with diabetes, their body is still responding in a different way. Because a lot of that time, you know, you have the ability to produce insulin. They may not. So
They
they're
need the
corrected.
injections, yeah.
Yeah, so, you know, if they are somebody who is dependent on insulin or uses insulin as diabetes maintenance medication, over administration of that medication may result in a drop in your blood sugars. So, when your blood sugar drops below 70, you have to correct it. But the good thing about it is you can eat carbs, very simple carbs that can raise your blood sugars pretty fast. They say within a 15-minute period. So also knowing your body in that factor kind of know how much grams of carbs you might need, and then you can always take more, or you can stop taking the carbs after you've rechecked your blood sugar. So that's what I call the 15 and 15 rule. Okay? And with diabetes, I know that you were asking about checking it all the time. Most people with diabetes do have scheduled times that they just have worked into their schedule that they check their blood sugars. And also there's always a factor of like insurance, because diabetes maintenance medications and tools do cost money. So, you know, somebody may only be insured for, let's say, 2 strips a day, or somebody may be insured for 4 strips a day. So, you know, those extra strips do come out of that person's pocket. So that's also a factor as well.
And you need a prescription for a lot of those.
Exactly. So, we have come up with a slogan of active snacks. All right? So,
Carry them.
Exactly. So, examples of snacks that contain about 15 grams of carbs. Glucose tablets, which are over the counter. You can find them at the grocery store or CVS. Gel tube of glucose. It's very similar, but just a different consistency. 4 ounces of juice or regular soda, not diet. So that's like maybe 4 ounces of orange juice, or 4 ounces of like Coca-Cola or Pepsi, but not diet. 1 tablespoon of sugar or honey, or hard candies such as jelly beans and gumdrops. And it can be smart if you are prone to having hypoglycemia to carry on some candies as well. And these are some examples of what you can use as...
That looks like you can have a 6-pack of Pepsi.
I know, I'm sorry. So it should only be about 4 ounces per 15 grams. So you would take that 4 ounces and you would retest your blood sugar in 15 minutes. And if it's still low, maybe another 4 ounces, and then recheck in 15 minutes. All right. Things to remember. It is important to not eat as much as you want until you feel better, because eating too much can make you become hyperglycemic. And this is also knowing your body and knowing how your diabetes is with you. Okay? Knowing your signs and symptoms and always carrying a snack. Alright, so for calling your doctor or calling 911 in the event of hypoglycemia, severe hypoglycemia left untreated can cause severe events such as seizures or coma. Speaking with a doctor about whether you should buy a glucagon kit, how and when to use it, and how it works with your 15-15 rule. If you see someone unconscious and glucagon is not available, call 911 immediately, because it does need to be corrected. Alright, so that is the end of the slideshow. Is there any other questions that you had?
I saw on TV they have a thing that you can put on your, you don't have to do your finger.
Continuous blood glucose monitoring?
Yeah.
So I don't have extensive knowledge on this, but from what I have seen, There are monitors that monitor your blood glucose, but also administer insulin based on your body's needs. And that's like pre-programmed through like a diabetes educator or endocrinologist's office. And they also, I think, can like Wi-Fi those numbers as well. But yes, so what you are talking about is a continuous blood glucose monitor, and there actually is a needle that's administered under the skin subcutaneously. It's
Oh,
very
there
small.
is a needle in there.
Yes, yes,
Ah.
but it's not. It's it's there for a period of time.
Uh-huh.
Once it's placed, I see a lot of them in the stomach and on the shoulder, or like the the tricep, I guess. Tricep, yeah. So there's different types. There's some that monitor the blood glucose, and there's some that do both, that administer insulin as well. I know those do get expensive, and not every option like that is for everybody. Some people love it, some people don't. That's more of a a personal experience or opinion as to whether they like it or not. Yeah, but I do see that.
Yeah.
Yeah. So, any other questions?
I asked about those because was it Free Libre or something? The one that just monitors the blood sugar, you can scan with your phone or whatever.
Sure.
But I swim and you can't do it if you swim because it can get infected. So.
Yeah.
Are there any type of coverings that can remain waterproof?
I don't know. I
Probably
didn't
gets
ask that.
expensive though.
Once they said that it could get infected, I was like, a big thing.
Oh no, yeah. I mean, cutting down on infection is always a good thing. How about any other questions? I know that you had told me you're not on medication.
No, I took metformin for about 5 days when
Okay.
I was first diagnosed,
Sure.
and it made me very anxious. That's the best way to put it.
Okay.
I was not myself at all,
Mhm.
and so the doctor said, "Well, we'll try not to have you on it."
Okay.
So I've been fine without it.
That's
As long
great.
as I exercise and diet, I control it that way.
So that is always a goal to work toward. If you are type 2 diabetic, and your pancreas may not be making insulin, super efficiently, but it does maintain enough insulin in the body with proper diet and exercise to not have to be on medication. And that's something that that combination of treatment is definitely done with the doctor or a diabetes educator, as a collaboration. I wouldn't try to do that on your own, but that does take some time to kind of figure out what works for you. If you're type 2 diabetic, doesn't mean you're always going to be on insulin for forever, depending on your situation.